The cervical rotation lateral flexion test is used to assess for first rib hypomobility. And so let's say on the left side, my first rib is hypomobile. To perform that test, it's passive flexion to the right. So you do opposite rotation and then lateral flexion. Why would that test block, or if the first rib is hypomobile, why would the lateral flexion be blocked with that? Well, as you look to the right, it's going to put the anterior and middle scalene, which attach onto that first rib, onto a stretched position. And if someone has an elevated first rib already, we know the anterior middle scalene are going to be holding more tone. So if the first rib is elevated, those muscles are in a shortened position, which is seen as hypertonicity in the muscle. So when you look to the right, you're putting more stretch on those muscles already, which pulls that first rib up. And then to try to laterally flex in that position is not going to be possible because you're going to be butting the transverse process of C7 into the first rib. So it becomes this mechanical block that doesn't allow the movement to occur. Now, it's a mechanical movement test, and you might ask yourself, well, why is there no good diagnostic accuracy behind the test? And the reason is that, well, one, there's so many other joints that can help move through that area. So there's a lot of moving parts that we're talking about. The ability to get to certain ranges is going to impact the ability of that first rib to block the movement of it. So there's this issue of how much rotation is available, how much lateral flexion does the person normally have, what's the position of the thoracic spine and the CT junction. If I'm here and then I look all the way and drop down, that's going to already be a more blocked position. So one's starting posture is a huge consideration as well. So when you're doing the cervical rotation lateral flexion test, I would perform the test just to compare side to side, check for irritability, and then lastly, see what their capacity is for that movement. It doesn't necessarily mean the first rib is hypomobile, but it'll give you indication on what tissues are being stretched, how those tissues move in different directions under tension, and then it may also help influence one's further treatment and assessment, knowing that there's something going on with putting tension on the scalenes and how that's impacting the first rib. So those are some clinical considerations for the cervical rotation lateral flexion test.